Welcome to my presentation, Mood Disorders, Understanding Symptoms and Treatment by Nicole Spalding. Mood disorders are mental health conditions that primarily affect our emotional states and disrupt everyday life. Studying mood disorders is imperative because of the overall effect it has on one's life. Understanding causes, risk factors, and effective treatment is important to a person's success in living with the disorder. The earlier these conditions are diagnosed, the better. It will prevent things such as self-harm or suicide. In this presentation, we will discuss a few of the most prominent mood disorders. Dysthymia, known as persistent depressive disorder or PDD. PDD symptoms include sadness or depressed mood nearly every day, feelings of hopelessness, low self-esteem, and irritability. May have trouble concentrating or making decisions, have feelings of worthlessness or guilt. They may even suffer from fatigue or low energy, change in appetite, or sleep disturbance. Diagnosis comes from the DSM-5 criteria: depressed mood for at least 2 years, at least two additional symptoms as mentioned above. Symptoms are steady, over 2 months at a time, no history of manic or hypomanic episodes. Treatment options available for this disorder would include psychotherapy or talk therapy, such as cognitive behavioral therapy, interpersonal therapy, and mindful-based therapy. Certain medications can be prescribed to help with the serotonin in the brain, as well as mood stabilizers and antidepressants. Self-help and lifestyle change could also be needed as well. Bipolar types 1 and 2. Bipolar is a mood disorder characterized by extreme mood swings, including manic or hypomanic and depressive episodes. Go a little crazy. Bipolar can come from biological causes such as genetics, brain chemical and structure, as well as hormonal imbalance. Severe stress or trauma can trigger episodes. People who suffer from bipolar may also suffer from substance abuse and sleep disturbance. Diagnosis in the DSM-5 criteria: bipolar 1, at least one manic episode with or without major depressive episode. Bipolar 2, at least one hypomanic episode and one major depressive episode. Diagnosis made through clinical interviews, patient history, and psychological testing. Treatment options include medications such as mood stabilizers, atypical antipsychotics, and antidepressants, cognitive behavioral therapy, pseudoeducational, and interpersonal therapy, as well as lifestyle changes and self-help are important. Seasonal affective disorder, or SAD. Seasonal affective disorder is a type of depression that occurs seasonally, usually in the fall or winter months, when daylight hours decrease. This disorder is more common in women and young adults. Certain biological causes would be disruption in the body's internal clock, a neurotransmitter imbalance, or a melatonin overproduction. Symptoms of SAD include persistent low mood, loss of interest in activities, fatigue and low energy, excessive sleepiness, increased appetite, difficulty concentrating, and social withdrawal. The diagnosis, the DSM-5 criteria: depressive episodes occurring seasonally for at least 2 consecutive years, symptoms improve in summer months, and you must rule out other mental health disorders or medical conditions. Treatment options for SAD include things such as light therapy, also known as phototherapy, and different medications are available, such as antidepressants or serotonin inhibitors. Cognitive behavioral therapy, as well as lifestyle change, relocation along with self-help, are effective with this disorder. Other mood disorders not mentioned in this presentation include major depressive disorder, MDD, premenstrual dysphoric disorder, PMDD, disruptive mood dysregulation disorder, DMDD. It's a lot to live with. Thank God there's such things as references out there. For my presentation, I have used the DSM-5, the American Psychiatric Association website, the National Institute of the Mental Health website, the Mayo Clinic website, as well as our psychotherapy textbook. In conclusion, mood disorders can be managed easily with diagnosis and the right kind of treatment depending on needs. Education along with awareness is important for building a person's support system. Being able to openly talk about things going on and seeking help when needed can improve the quality of one's life. We have resources available to us today that we were never available to us before. Seeking help is not a weakness, it is a sign of strength, the same way compassion is a sign of love. Thank you for watching.